YouTube. Now, this is AA4 Alpha microphone for Whiskey Bravo 5 Delta, the Medical Amateur Radio Council Grand Rounds on the Internet, healthcarehams.org. And today we're talking about statins. We're having a group discussion, a forum, getting wisdom from our members that are present on the origins of statins to whether or not this is a standard of care. That's a question at this time. But in 1987, a new medication hit the market, a statin, of course, a class of medications. It was going to be the best thing that ever happened to the cardiac field. And the expectation was the elimination of plaque building up in arteries so that heart attacks could be a thing of the past. Well, we're here almost 40 years later, and there's still heart attacks. They're still a major killer in the US. And, yet doctors often suggest anyone over 40 should be on a statin. So let's explore that subject today. And this is Jay Garlitz. I happen to be a dentist, not a physician. Done my due diligence on research, and we're going to get input from our physician members that are present as well. And the Medical Amateur Radio Council meets weekly, of course, here, as I mentioned, on shortwave ham or amateur radio. For those of you listening on YouTube that may not be familiar with amateur radio, we explore one of our passions, which is having interactive forums on health-related topics. So you may hear explanations on a subject, in this case statins, but realize they're not medical recommendations for follow-up on the subject matter covered as it pertains to your health. Speak to your healthcare team members. A historical perspective on the discovery of statins, as we mentioned, 1987, and it was known that cholesterol is essential for the functioning of all human organs, but nevertheless, it's the cause of coronary heart disease. And over the course of nearly a century of investigation, scientists have developed several lines of evidence that establish the causal connection between blood cholesterol, arteriosclerosis, coronary heart disease. But building on that knowledge, scientists and the pharmaceutical industry have successfully developed a remarkably effective class of drugs, the statins, that lower cholesterol levels in blood and reduce the frequency of heart attacks. So we're going to discuss the background and considerations to better understand the issue. Now, if you're listening here on HF, on 20 meters, do realize that my prompts are driven by slides, a PowerPoint presentation. And what I've done, if you go to healthcarehams.org, you can bring up the slides for today's presentation. I will describe the different research articles in case you don't bring that up, but you do have active links in that PDF of the slides today. So I encourage you to go to healthcarehams.org, and on the right-hand side under posts, you'll see that link. And thank you for being here with us today. Do we have, since you've had a chance to hear what the subject is on today, if you're listening on 20 meters, we'd appreciate you checking and make your call now to Whiskey Bravo 5 Delta. Okay, no further check-ins. When we talk about coronary artery disease and heart cholesterol, and we're talking about buildup in our arteries there. So, healthy arteries, the blood's flowing freely through, and you start to get fatty deposits and plaques on the inside of the vessels for whatever reason, cholesterol being part, and you can end up with a near complete blockage leading to, heart attack. It's important to stay healthy in a variety of ways, including the use of statins when appropriate, appropriately suggested by your medical team. So can the statins reduce your risk of a heart attack? Now, there's an article in the US News. First, we're just starting with what a non-scientific necessary articles that are on the internet. And this was on usnews.com, and it's Healthcare for Better. And the article is called, Can Statins Reduce Your Risk of Heart Attack? So in quotation, an ounce of prevention is worth a pound of cure. And this is Dr. Kukami. This was written in 2017. And the way to figure out if a statin's right for you is to have a conversation with your primary care doctor, your cardiologist. And for those of us that believe in the power of preventive medicine, that's the mantra, is the driving philosophy. And as a cardiologist, he knew that statins, medicines many take to reduce their cholesterol, play a large role in his efforts to prevent heart disease. So, the question about standard of care and whether or not this is commonly used for everyone over the age of 40, and if it benefits everyone, is a question of what is the standard of care as it changes. These medications were introduced in 1987. You would assume that the standard of care and their use has changed many times through the years from research. And this particular question was brought to us for discussion by Carl, N0ARN. And Carl was concerned with standard of care. He's had family members that were in treatment for various maladies, and he was not sure what the standard of cares were at the time on the particular topics and whether or not they were appropriately applied. But for some of this person's patients, Dr. Kulkarni, statins were a tough pill to swallow, and they wonder, why take a medication with potential side effects when you're unlikely to feel any different, just so you may reduce some theoretical risk of a heart attack in the future. So understanding how statins work and the real risk of side effects can help reduce some of the anxiety around the medication and guide the conversation with your doctor as whether or not a statin is right for you. Let me break one. This is Whiskey Bravo 5 Delta Grand Rounds on the internet, operating today out of Hawthorne, Florida, home call AA4FL for ID here. Do we have any further check-ins? Make your call to Whiskey Bravo 5 Delta. Well, we don't, but nice thing, we have a quiet frequency now. The QRM has disappeared. So how do statins work? How do statins work? And I see we're starting to get some chats here. So the link to the PDF, if you go to healthcarehams.org, the website, healthcarehams.org, and it should be listed under posts on the entry page. On the right side of the page, scroll down a little bit off the header, and you should be able to find that. Brad, if you don't, just send me another message, but it should be there. So how do statins work? The most well-known effect of the statin is to reduce the amount of cholesterol in your blood by changing the way some proteins work in your liver. Okay, you found it. Great. Thank you for posting the link here to our Zoom. Understanding how statins work and the real risk of side effects can, of course, get rid of the anxiety, but by reducing the total bad cholesterol, and that's something that you need to realize, there's more than one breakdown or component to cholesterol in your blood. The statin makes it less likely that cholesterol will form plaques or blockages in the blood vessels going to your heart and brain. So Munir, we have N3PQ with us here, a neurologist, and we'll hear from Munir, I'm sure, on his perception of plaques and how that affects the brain. And there's also a second lesser known and much more important effect of statins. It's not just the blockages, it also has to do with the mix of cholesterol, calcium, and scar tissue, and what determines the stability of the plaque. So this has an effect on it to make it more favorable for you, to offer you protection, even if your cholesterol is more nearly normal, because you don't want to have damage of the vessels itself for the plaques to accumulate. Excuse me for a second here. So the standard of care, who should take statins? Again, the same doctor, Dr. Kulkarni, written in 2017. So many people who could benefit from statins, but not everybody needs to be on a statin. Of course, for each person, the decision must be a balance between the potential benefits and the risk of side effects. And there is a U.S. Preventive Services Task Force, a group that looks carefully to all the available evidence and makes recommendations on the preventive course that make the most sense. And they recommend statins for certain people between age of 40 and 75. And if you fall in this age group and have some additional risk factors, such as family history, diabetes, high blood pressure, or smoking history, they recommend taking statins to reduce your risk of heart disease. And importantly, the same guidelines also suggest that not everyone in the age group needs to be on statins. If you're at lower risk of heart disease, for example, you may not benefit from the protective effects of statins, as the baseline risk of heart disease is so low. And in his particular practice, he has a conversation about statins with his patients in that age group. And the only way to figure out whether they're worthwhile for those patients to take is understanding the risks and benefits in each individual case. And they come to a decision together about whether to take statins. Can I take a list here from those of you on 20 meters that would like to make a comment about what you did when you were in practice and what you suggested to your patients? Go ahead and make your call to Whiskey Bravo 5 Delta, and I'll make a discussion list. Is there anyone on Zoom that would like to discuss or tell us about the discussions that they would have with their patients? So you can make your call to Whiskey Bravo 5 Delta by way of Zoom. Okay, none currently. Again, this is just a non-scientific article from U.S. News. This is the kind of things hopefully your patients research and find on the internet. But the standard of care issue, again, there are a few more controversial questions in medicine. That's because of tens of millions of people take statins, presumably to prevent heart attacks and lengthen their lives. And this comes from a website called peoplespharmacy.com. And the article is, "Do Statins Save Lives?" And that the doctors don't agree. So you got to realize there's still different varying opinions for hopefully explained reasons. Just because you read something on the internet doesn't make it true. So as a ham radio operator, and you guys are pretty attuned to what's out there in the world and technology, just realize that you need to check very reliable sources and many sources. At least the implicit promise when you take a statin type cholesterol lowering drug is to prescribe it to an otherwise healthy person to reduce heart attacks and lengthen their lives. But why? Why do we do that? So there was a study in the Journal of American Medical Association, Journal of Medicine, suggesting that statins are not as great as thought for preventing heart attacks with most patients, as clinicians believe. That doesn't mean it's not beneficial. Just the perceptions are changing into which groups are benefit buying. And also in the New England Journal of Medicine, similar issues have been raised. So many health professionals would challenge the findings, but those two journals are pretty well known. So the statin promise is most doctors consider statins the primary pillars for the prevention of heart attacks. So what do we have for heart attacks? At least 28 million Americans take atorvastatin daily to lower their LDL, the number one most prescribed drug in the country. Another 8 million take rosuvastatin and 7 million simvastatin. So there's more than one in our class that's taken. But what other issues arise here? Because with so many people thinking that, you would think there'd be a lot more progress at controlling cardiovascular disease, that initial anticipation that the arteries wouldn't be clogged. But you also have to realize there's other factors. There's smoking, and if you quit smoking in tandem with taking a statin, you would think that cardiovascular disease should no longer be our number one killer. But yet you have almost 1 million people that died from cardiovascular disease in the latest tally at the time this article was written. So both healthcare professionals have embraced the guidelines that require a statin-type cholesterol-lowering medication for anyone with elevated LDL, and we'll talk about the different varieties of healthy and unhealthy cholesterol components. So in addition, the American Heart Association, the College of Cardiology, has worked hard to promote blood pressure control. So that's another medication to help to be cardiovascular healthy. Then we have a variety of medications to help control obesity as well. Things like the Ozempic and Wegovy. I mean, our age group tends to watch the TV news. I don't think the younger people watch the 6 or 6:30 evening news as much. But it must be us, because every commercial seems to be targeted to Ozempic, Wegovy, and similar medications, the GLP-1 agonists. And those decades worth of statins that are been prescribed, plus the blood pressure drugs like the Citalopram, which is 20 million patients, And other blood pressure medications also are in the millions, tens of millions of prescriptions are being given. And there's only one more statistic that smoking is a major contributor. So this is something that all the above can help reduce the chances of cardiovascular incidents. So what about the historical perspective on the discovery of statins? But before we move on to that, I'm going to break one. This is a forum, an interactive forum. We want to have participation for those of you that are either here on 20 meters or on Zoom. If you're on 20 meters, before we move on to the historical perspective, do we have any comments that you'd like to make? I'm taking a list from the 20 meter side now. Make your call to Whiskey Bravo 5 Delta. Okay, no comments. Do we have any on the Zoom side? Any comments or questions? Make your call. Okay, none currently. Before we move on to the discovery of statins, Andy, can you, WJ8B is here with us today. Andy, can you tell us a little bit about your use of statins with patients and reflect on the comments that were just made by the authors of these comments that were sourced online? Go ahead, WJ8B, Whiskey Bravo 5 Delta.
Okay, well, statins, I first knew about them actually in medical school, which was still in the 70s. They weren't available for general use at that point, but some of our cardiology people and endocrinologists were aware of it at the University of Cincinnati. And some of the earlier statins did cause some liver dysfunction. They were highly concerned about that. They were studied more so in the mid-80s, 87, I number you quoted. They became readily available, and they weren't being given to everybody at that point. But as time went on and we had outcomes data on many of the drugs, it was clear that they did reduce cardiovascular mortality in terms of stroke and heart attack in particular, but also peripheral vascular disease as well, and occasionally rare vascular complications such as mesenteric insufficiency, etc. The biggest problem with statins as a clinical physician for years, written lots of prescriptions for it, was myalgia or muscle ache. We never really saw much liver dysfunction. I think I saw maybe one or two cases, but the incidence of the myalgia and muscle ache was probably in the 15 to 20% range, and that was enough to cause a lot of people to not take them. And I'm one of those. I have a very strong family history of this. Of course, non-smoker and no risk factors there. But my younger brother developed a 90-some% LAD lesion when he was 42. Now he was smoking, of course, but I have a strong family history, and so once the newer drugs became available, and those are the monoclonal antibodies for Patha and Praluent, I was able to take those. They don't cause any muscle pain, cause a little throat irritation for a few days after you take it, and it goes away. And my LDL cholesterol with those drugs, I had one, and then I had the other because the formulary change is incredible. I mean, it's just completely lower. I had vascular studies done in 2020 because I had an episode of AFib, and I did have a 40-some% lesion in my left carotid and a 30-some% lesion in the one of the ostial arteries of the heart. And recently I had the ultrasound done on my neck over again, and the plaque buildup was completely gone with that drug. So it's clear they do work. The goal, of course, is to get the LDL-C as low as you can and the HDL as high as you can. Exercise does help with that as well. So, and of course, control of diabetes and blood pressure also are factors. So back to you, Jay, from WJP.
Thank you, Andy. WJ8B, Whiskey Bravo 5 Delta, AA4FL at the microphone. We appreciate that excellent and extensive discussion here. Munir, N3PQ, can you tell us a little bit about on the neurology side and carotids, any experiences from practice that you can think of?
Yes, hi Jay, this is Munir, N3PQ. Absolutely. So, statins, as you all know, are very commonly used to prevent or to reduce the risk of stroke. This is especially so in people who have had a stroke or a TIA. There was a study done some time ago called the Sparkle trial, where with intensive statin therapy, the risk of recurrent stroke was down by 16% in people with recent stroke or TIA. In atrial fibrillation, it supposedly, again, reduced the risk of thrombotic stroke and systemic embolism by 17%. This is on the side of stroke. Of course, there are the side effects that were alluded to, including the muscle side effects. If you want, I can also address some of the other benefits to the brain besides reducing the risk of stroke. This is N3PQ. Over back to you.
Okay, thank you, Munir. We'd love to hear that. If you would like to discuss that, we can do that before we talk about the historical perspective of the discovery of statins. I think that our listeners here and our participants on 20 meters and on Zoom would probably be fascinated by what you have to say. So I'd be more than happy to give the lead. Are you talking about discussing that today, Munir? N3PQ or at a future time? N3PQ, Whiskey Bravo 5 Delta.
Say again, Jay, I didn't quite get your question.
Is that a topic that you're prepared to talk about today, or was that a topic you wanted to talk about in the future, other ways that they help the brain? Over.
Yeah, maybe in the future. I mean, I could comment today very briefly. There are some studies that is supposed to reduce dementia risk and produce some neuroprotection, some anti-inflammatory and cognitive function. But again, there are other studies contesting that, and there are studies on both sides. But yeah, we can definitely make it a future topic if you wish.
N3PQ, Whiskey Bravo 5 Delta, AA4 FL microphone. Today, operating out of Hawthorne, Florida. Whiskey Bravo 5 Delta is the club call of the Medical Amateur Radio Council. It's a heritage club call. It's been with us for years. We have Chip N5 RTF with us. Chip, would you like to say a little something about Whiskey Bravo 5 Delta, our club call, where it originates from, before we talk about the origins of statins? How about the origins of our club call?
Sure, and I have some comments on statins themselves. WB5D was a call that belonged to Robert Currier, who was the chairman of my neurology department when I was in medical school and in residency. And I met him as a student long before I knew he was a ham operator. But I heard his voice on the air one Sunday morning and recognized it. It was very distinctive. And then asked him about it at the hospital later, and he told me about Marco, and I joined. But we requested from his widow permission to take his call sign after his death and make it our club call. And so we're proud to continue using that call indefinitely. Great man. He was net control for probably 20 years before Warren took it for another 20. So it's been a long time. We've had basically two people in charge of all of our nets. So do you want to pause before I say something about statins?
We have N5 RTF with a microphone out of New Orleans. Why don't you go ahead? That would be wonderful if you would offer some personal comments about statins. Chip, go ahead.
Yeah, my experiences have been negative. I've had several patients who presented with complaints of cognitive clouding, poor memory, confusion, mild delirium, basically. And it was traced to the fact that they had been put on statins. They got off and the symptoms went away. Now, again, just like the myalgia, it's not everybody. In fact, it's probably a minority of people that have the cognitive effects. But one thing you have to remember about cholesterol is that 20% of your brain is cholesterol. And we know now that the organs of the body are not static. They're not manufactured in place at age 21 and never change. They are constantly being scavenged and remodeled and rebuilt. It's an ongoing process. Every cell, every connection in the body is gradually being reworked and replaced every day that we live. The cholesterol is necessary to maintain the structural integrity of the brain. It cannot cross the blood-brain barrier, so it can't come from your diet. It has to be made in situ within the blood-brain barrier, and some of these statins actually block the enzymes that allow new cholesterol to be built inside the brain. So you are really impairing the recovery mechanisms within the brain of the brain itself. So you have to think long and hard, again, risk versus benefits. Yes, it cuts down the chances of stroke, but it also may decrease your quality of life from not being able to think as clearly. So again, it's not everybody, but if you have a patient that complains of that side effect, you have to think long and hard before you keep them on that drug. N5-RTF.
Well, thank you for your input, Chip. N5-RTF, Whiskey Bravo 5 Delta. You know, there are some comments that are being made today that I wasn't aware of, and thank you for that, Chip. The other comment that was made, Munir made about the muscle effects, and Andy made about the muscle effects. I wasn't even aware of that until I started doing my due diligence and preparing for today. But you know, I occasionally have some muscle soreness in areas that I can't explain. I want to make sure that it wasn't actually heart disease. It's not in those traditional areas. So in a way that might decrease some of my anxiety, knowing that that's a potential cause, but you know, who knows? We're very complicated organisms, are we not? Yes, very. We may get replaced by AI because I think that they may be simpler.
Jay, one more comment, please.
Go ahead,
With regard to myalgia, I would just like to remind everybody, just like we did with the myalgia from the COVID vaccine, the heart is a muscle. So if your muscles are aching, your heart probably is too.
Okay, thank you, Joe. I appreciate that additional comment. Moving on to the historical perspective, and Andy, you had mentioned being familiar, WJAB, with statins when you were in medical school in the 1960s, and as we look at the historical perspective of statins, and you know, the first isolated from gallstones in 1747, cholesterol's fascinated scientists in many areas of science and medicine, and 13 Nobel Prizes have been awarded to scientists who devoted major parts of their career to cholesterol research. And if we look online for this particular article, I'll see if we can't find the name so you can find your way. Let me mention once again, though, on healthcarehams.org, I do have the slides that I'm prompting today's discussion, interactive discussion forum off of. So you have access to those. Just go to healthcarehams.org, and on the entry page, on the right-hand side, look under posts. There'll be a link to the PDF versions of the slides that have all the active links to the articles. And if you're on 20 meters, that way you won't have to just rely on the HF broadcast. But wherever possible in the HF discussions, we will certainly try to describe in detail so you can find on the internet what we're discussing. So there are animal models in arteriosclerosis is a long-term research area. During the 19th century, arteriosclerosis was well recognized, but its etiological and pathological, excuse me, I think I need some water. significance had not been established. The hypothesis explaining it ranged from disturbed arterial metabolism to adherent blood clots. They gradually changed into arteriosclerotic plaques. And the first hint that cholesterol was related went back to 1910. But serious research on the role of cholesterol in human arteriosclerosis did not really get underway until the 1940s due to a prevailing view that disease was a simple consequence of aging and could not be prevented. But the historical perspective on statins and the regulation of cholesterol metabolism has been extensively studied, again, getting to what Andy said, in the US in the 1960s. So Andy, I assume this is the type of discussions that were going on in medical school, but I'll let you offer the input, and maybe you can even describe HMG-CoA reductase. I assume we're talking about enzymes and we're talking about the liver. Cholesterol in the body can be derived from what is absorbed from the diet and what is synthesized in the body, mainly by the liver, and it's supplemented by the latter if requirements are not met. When exogenous cholesterol reaches its required level, this synthesis function of the liver is suppressed to prevent excessive production of cholesterol. So feedback suppression of cholesterol synthesis in the liver by dietary cholesterol is mediated through changes in the activity, the enzyme we just mentioned, that catalyzes conversion to another substance, valinate. So changes in the reductase activity are closely related to changes in the overall rate of cholesterol synthesis. In humans, cholesterol produced in the liver exceeds what is absorbed from the diet, even when a large quantity of cholesterol is ingested. So, Andy, is for going back to your medical school days and knowing the information here on this particular diagram that we're trying to describe here, it's available on the slides from our website. Would you like to make any further comments? Is this what you were being exposed to when you were in medical school? WJ8B, Whiskey Bravo 5 Delta.
Okay, well, you have the years wrong. I was in medical school, 1974 through midway 78. And so this would have been, was talked about during our internal medicine clinical rounds, where we, got into this and talking about the drug. And that would have been in 1976 and pretty much duplicated what you have on your slide. We knew it was an HMG-CoA reductase inhibitor. And so there was a lot of promise. People were talking about it. I'm not sure whether the faculty had permission to use it yet. We weren't allowed to write for it. I don't think it was available to us directly. Of course, when I was in residency, then they did start to show up, and that would have been, 78 through 81. So, but that's, the slide's pretty accurate. It's just the time was off.
Okay, thank you. Sorry to prematurely age you there, Andy. But the research from the 1960s was made available to you. I'm not sure if it was introduced in Europe before the United States, and maybe they predated 1987. Perhaps we'll see that a little bit more. The particular author of this article, Akira Endo, a Japanese researcher, I think he's a biochemist, and that's how you can find this article online, Historical Perspective on Discovery on Statins. Of course, me as a dentist, having endo, endodontics, so endothelial, I mean, endo is a common word in medicine. So epidemiological studies in the early 1950s were made of the cholesterol coronary connection at the UCal in Berkeley. And that moved on to determine that heart attacks correlated with elevated levels of blood cholesterol, but also that cholesterol was contained in low-density lipoproteins. He observed that the heart attacks were less frequent when the blood contained elevated levels of high-density lipoproteins. And Andy had described that earlier, medications that wanting to maximize your HDL and minimize your LDL. So when living in New York, this particular biochemist, when he was doing his research, he was surprised by the large number of elderly and overweight people and by the rather rich dietary habits of Americans compared to those of the Japanese, back then, in those days in the 1960s and 70s. And the residential area of the Bronx where we lived, the Bronx, there were many elderly couples living by themselves. And you often saw ambulances going to take an elderly person who suffered a heart attack to the hospital. And at that time, coronary heart disease was the main cause of death in the United States. And hypercholesteremia, the precursor to coronary heart disease, was said to exceed 10 million people at the time. So now we're getting into that diet issue that we really haven't talked about yet. Being able to control one's diet, and in addition to taking a medication. And one comment that came to mind when we were in Orlando recently at Hamcation at the meeting, and last year at Hamvention in Dayton, was I was with a few physicians at our booth, and a comment was made is, look how many amateur radio operators are in scooters and how poor looking they look. And these are people that are in their obviously in their 60s and 70s. So diet and exercise. Medications are not a magic pill, they're an adjunct. And do realize that we are in a hobby that's fairly sedentary. So we do need to find our way to exercise. I'm guilty as charged to a degree, although I do enjoy working in the yard and being out and exercising in that way, but you can always exercise more. And getting back,
We should climb more towers.
N5RTF comment, we should climb more towers. I don't think that would be healthy for me, Chip. That'd be a quick way to heaven for me. Instead of reaching the heavens, I would be coming down and finding him. But we're talking about the blood vessels and the HDLs and the LDLs. You'll hear your doctors talking to you about bad cholesterol and good cholesterol and triglycerides. You'll see your blood work come back, and all the three components are there. And in consultation with you and talking about your family history and your blood values, and just the other questions, answering them that your physician and in conversation with you obtains. Together, you can discuss whether or not statins are healthy for you, if they're useful for you. There's a historical perspective on the discovery of statins. That same article will give you a list of all the different statins. If you want to read the detail, that's a PDF that's available to all. It's not something that's just a protected medical journal. So just look for Dr. Endo. So as we go to the other basic studies that have influenced whether or not benefits of statins may be overstated, we previously mentioned two particular studies, and one of those information was directed to the public. The author was Paula Byrne, and this was from 2022, so this is more recent, the new study. And what she describes, the website's called theconversation.com, and that benefits of statin may be overstated. New study would be the title as you Google it. The cholesterol-lowering statins are one of the world's most commonly used medicines, first approved for people with a high risk of cardiovascular disease in 1987. And by 2020, global sales were estimated to approach $1 trillion, or 764 billion pounds sterling. So, however, we have an ongoing debate as to whether or not they're overprescribed. Does everyone who takes them really benefit from them? And to find out, her colleagues and herself found 21 relevant clinical studies that analyzed the combined data, 140,000 participants, and made a meta-analysis asking two questions. Is it best to lower LDL cholesterol, sometimes known as bad cholesterol, as much as possible to reduce the risk of a heart attack, stroke, or premature death? And how do the benefits of statins compare when it comes to reducing the risk of those events? So in the first question, they found a surprisingly weak and inconsistent relationship between the degree of reduction in LDL cholesterol from taking statins and a person's chance of having a heart attack or stroke or dying during the trial period. In some trials, the reductions were associated with significant reductions in the risk of dying, but in others, it was not, that risk was not linked. So there are studies out there, it's still ongoing research. And she had graphs. And you realize, though, when they're talking about a reduction, and we're talking about as much of a 9% reduction for death, 29% for heart attacks, and 14% for strokes. That's for those particular reduction in taking them. But in terms of overall your chances of dying of a heart attack, the absolute reduction is 0.8%, less than 1%, of having a heart attack, 1.3%, and having a stroke, 0.4%. That may sound trivial, but think about the population. That's a lot of people, even if they're reducing it by less than 1%. That's a significant number of people that are still benefited. So you have to look at these figures and say they're not belittling the numbers, but they're also not pointing out how the absolute number of people that represents. So if you go online, you'll find that article as well as these graphs and charts, that the data that I'm describing from. And I guess in Europe now, the proportion of people that are eligible to take statins has gone up in the beginning from like 8% to 62% of the population. It's plateaued between 2012 and 2016, that 61% area. I don't see the statistics since then, but it's very common that people are eligible. That's a lot of people taking it too. So statins, the drug, cholesterol lowering drugs, are they appropriate for you? So Mayo Clinic, this is online, high blood cholesterol in-depth statins and the arts. And let me break one just to identify. This is Whiskey Bravo 5 Delta Medical Amateur Radio Council Grand Rounds of the Internet, which takes place every week during this time. It's our net where we discuss in a round table our passion. Our passion is healthcare related items. Now we tie ham radio to our professions or areas of interest. Not everyone here is a health professional. We have members from all walks of life. Do we have anyone here that's listening at 20 meters that would like to check in at this point, late check-ins? Go ahead and make your call.
Charlie 1, Charlie Whiskey.
Kilo Charlie 1, Charlie Whiskey. Thanks for being here with us today, Herb. Nice to hear your voice. Do we have any other late check-ins? Make your call.
Your comment.
We'll have the comment in just a second, Herb. There was a Romeo Delta station. Make your call again.
Your 5, Romeo Delta.
Okay, I got the Kilo 5 Romeo Delta. What's the last letter?
Sierra.
Roger, Sierra. Roger.
Roger.
Okay, thank you for being here with us today. KC1CWW had a comment. Herb, go ahead with your comment.
Yeah, I'm getting a little facetious, but I told you late and found it interesting because I am on a statin. And just over the last half an hour hearing the comments regarding it, my blood pressure has gone up. Go ahead.
Oh, well, we don't want your blood pressure to go up because that's another risk factor. But Herb, the entire discussion today, or the interactive forum with all our input from our hams present, especially those in the medical community, is going to be available as a YouTube video. So we do have a YouTube channel, Healthcare Hams YouTube channel, and sometime later today, the recording from today should be up and available. QSL?
No, thank you very much. I enjoyed it very much, and where I'm on it, it was noteworthy. Sometimes we wonder the pluses and minuses of each of these drugs, of course. But I've been on it for quite a while, and everything seems to be stable. But the comments about it, they put a lot of question marks around it. Is it really needed to continue, and so forth and so on. But I find the segments that you guys present extremely interesting. It's a great forum. Thank you very much for
Okay, thank you, Herb. And if you're watching the Celtics, playoffs, that also is increasing your blood pressure. So, take it easy up there in New England here. And the Red Sox, we won't even talk about, because I don't know if they're gonna make the playoffs this year. And you realize, everyone that's listening and participating today, this is the discussion you need to have with your physician, your medical team. Here, we're just have a passion for these subjects. It's not medical suggestions. We're just laying out some of the research of what we're finding, some of the experiences that we've had with patients or friends or family members, and the discussion as to whether or not the benefit risk is appropriate for you, your age group, your background. That's a thorough discussion you need to have with your medical team. So the Mayo Clinic, though, put some information out online on whether or not these drugs are right for you, and you certainly can refer to their comments. And lowering cholesterol isn't the only benefit of taking a statin. There's a link to lower risk of heart disease and stroke, according to them. They also help reduce the risk of blood clots. And a number of statins available, they describe them. And earlier we've described them, and they're available to you in the slides today on healthcarehams.org, as we talked about. You can find our research and background material. But sometimes a statin is combined with other heart medications. And in doing so, it further increases, and this is something Andy had mentioned earlier, not being able to take a statin. But if you can take a statin, there's still combinations that can further. So you can see why it's important to have a thorough discussion with your physician. So should you be on one? That will depends on your cholesterol levels and other risk factors for heart and blood vessel disease. Your healthcare professionals will consider all those risk factors with you, but knowing your cholesterol number is a good place to start. So if you don't regularly go to your physician and you don't get blood work taken, you're not knowledgeable about your own body. And I would think you'd want to be knowledgeable about your body and your levels and be able to monitor. I mean, how can you know if you're going to improve yourself through exercise and diet if you don't have a baseline? So I encourage you to discuss with your physician and get your blood work run in the appropriate blood work, so that your low density lipoproteins or bad cholesterol can be looked at and kept to a minimum. If you have a history of heart attacks, a very high risk of heart attack or stroke, you may even to focus more on the LDLs to not get a recurrence. But your long-term risk of a heart attack or stroke is the most important thing that your healthcare professional will keep in mind when they think about statin treatment. But if your risk is very low, if your LDL is fairly high, the bad cholesterol, then perhaps you don't need a statin. Again, we're not here to make medical recommendations. We're here just to enlighten you to the research that's out there, make it available to you through that PDF file, and then you can discuss this with your physician. But the other factors, according to the Mayo Clinic: tobacco use, lack of exercise, high blood pressure, diabetes, overweight or obesity, narrowed arteries in your neck, arms, or leg, known as peripheral artery disease, family history of heart disease, especially before the age of 55 in male relatives, before 65 in female relatives, and like many of us in the amateur radio community, older age. So risk assessment tools are there at the disposal of your physician, and you can use, the healthcare professional can use that to help you in your decision-making process. And there's cholesterol guidelines that preventive task force that we discussed earlier puts out. And people who have one or more cardiovascular disease risk factors have a higher 10-year risk of a heart attack. That includes diabetes, high cholesterol or high blood pressure, or smoke. And then you think of a 10-year risk of a heart attack or 10% higher with that. People who already have cardiovascular disease related to hardening of the arteries, that can include people who've had heart attacks, strokes caused by blockages of blood vessels, mini strokes, which are also called transient ischemic attacks, blocked arteries in legs or necks, prior surgery to open or replace coronary arteries. And those people that we talked about with LDL cholesterol levels that we talked earlier, You can have hyperlipidemia, you have diabetes, that's a group that have cholesterol issues as well. So realize that you need to discuss these in details. The analysis should be by your physician, not what you read online. But at least you can ask intelligent questions and have an appropriate level of discussion. Now, when you talk to your physician, somebody as a health practitioner that talks to patients all the time, you do so in such a way that's constructive. You don't do it in a destructive, accusatory way. You look them in the eye and say, there's a lot of information out there, and if you always start by complimenting the health provider and say, I really appreciate your point of view, your professional point of view on the subject, and I'd be thrilled if you would assist me in interpreting my health risks. You're going to have somebody that's going to go to bat for you. So use some common courtesy, and I think you'll find that you won't have brick walls between you. You don't want to ever put anybody on the defensive. That's just human nature, and physicians are often very, very busy. But if they find that value in talking with you, they'll do so. Before we continue on, for ID purposes, this is Medical Image Radio Capsule. Grand Rounds near Whiskey Bravo 5 Delta AA4 FL. The mic, we're just about finishing up here. Do we have any other late check-ins? Make your call. Whiskey 2 Hotel Japan Kilo, is that correct? I do copy you. Okay. Thank you for checking in. Our net here will be recorded and will be available as a YouTube video here at on our Healthcare Hams YouTube channel. If you're interested in the conversation that we're having here today, do we have anyone here in our forum, our discussion group here in our net that can talk about the future? You might talk about Repatha and Zydia and some of the other drugs that are newer and out there. Is there anyone that would like to volunteer to talk about that in the future? Make your call to Whiskey Bravo 5 Delta. Okay, thank you for the suggestion. The suggestion came from Whiskey Bravo 1 Fox, Italy. So we do have a number of methods here for interactive discussions. We have both NetLogger running that we use and has an instant message feature, and we also having a Zoom session for our members that are not HF enabled, and they're able to chat, offer those individual comments. So we do appreciate everyone's input. So the side effects of statins, we've talked about that today in our discussion. Some of the commonly reported side effects, and this I think Chip and 5-RTF alluded to, was like the headaches or the brain fog. There's also nausea, mild increase in sugar levels we haven't talked about. The muscle and joint aches were talked about by WJ8B, Andy covered that. So, however, studies comparing statins to a placebo fake pill found a very small difference in the number of people reporting muscle aches between the groups. And for people who already have high sugar levels, the mild increase in blood sugar levels may lead to being diagnosed with type 2 diabetes. However, the benefit of taking a statin may outweigh that risk. So people with diabetes who take statins have much lower risks of heart attacks. There's some rare, more serious side effects, but very, very rare. Muscle cell damage and liver damage is possible. Some people have reported, as Chip mentioned, memory loss and thinking problems after using statins, but a number of studies haven't been able to prove that. But Chip and 5-RTF did mention that being a psychiatrist, he did have patients that had symptoms that cleared up once they stopped taking those drugs. So we'll defer to studies to determine whether that it was psychosomatic or not. But ask your healthcare professional if the statin you will use will interact with any other medications or supplements that you're taking. This is a discussion between you and your physician and medical team. What about that healthy lifestyle? Still the key for preventing heart disease. Lifestyle changes to reduce your risk. And this is from the Mayo Clinic. From an online available page for you to view on high blood cholesterol and depth statins. You can research that, Google it yourself. Quit smoking and avoid secondhand smoke. Eat a healthy diet rich in vegetables, fruits, legumes, fish, whole grains. Limit the amount of saturated fat, trans fat, refined carbohydrates, and salt that you eat. Be physically more active and sit less and maintain a healthy weight. So we talked about ham radio operators sitting in their chair for long periods of time. So if your cholesterol, the LDL, the bad type stays high after making healthy lifestyle changes, statins might be an option for you to get that number down. And consider statins a lifelong commitment. We think that if your cholesterol goes down, you don't need it anymore. But it's the medication to help lower it in the first place. So if that is the connection, talk to your healthcare professional and don't just cease to take them on your own. So thank you for visiting with us today. And for more information, you can visit us online at healthcarehams.org or Medical Amateur Radio Council's website, marco-ltd.org. And that's listed on our healthcarehams.org website. And what is Marco? Marco is a group that promotes goodwill and fellowship among amateur radio operators worldwide who are professionals in the healing arts or have an interest in the various medical, dental, and allied fields which constitute the healing arts. And of course, that's our passion on our net. And we appreciate everybody for being here with us today. And I'm going to go ahead and stop the recording for our YouTube video. We have continued discussion.